Okay, it's Jason from Angiodynamics. Going to run through the AlphaVac PE thrombectomy device, prep and procedure, and some tips and tricks. Try to keep this brief and to the point here. When you open up the box, you're going to find either one sleeve or two sleeves, but with the same components in them, no matter what your packaging is, of a handle like this, collection bags, probably a big long piece of clear tubing, which you can get out of the way. That's used if the handle is kept off the patient during the procedure. Most people don't use that. Our oversheath, dilator for the oversheath, and the cannula for the device itself. Setup is pretty simple with this. You're going to squeeze the handle, get that piece of yellow packing plastic off of there. Ensure this TUI valve is tightened, otherwise there'll be air in the system. Collection bag goes on the bottom. You can't snap it on wrong. There's only one way to do it. Cannula goes on the top. Again, ensure this is tight. Put the tip of the cannula in a bowl of saline. Pump the handle a few times till you see fluid enter the bag. This is prepped and ready to go. Sheath prep is relatively similar to any other sheath. Flush valve on here, flush this, lock it off to the patient. This valve right here, the dilator goes through. Give a quick flush on the back of the dilator. If you want, you can turn this little dial, kind of lock the dilator in there. Some physicians like that, some don't. Some like to leave it open. This is flushed, prepped, ready to go. So now everything is prepped. We're ready to start the procedure. So again, relatively easy setup. Couple things to know, just some best practices for the device. This is getting introduced up over a stiff wire, probably starting in the right PA like you would with any other procedure, if it's bilateral, saddle, pulmonary embolism. Dilator can come out of here, but when you pull the dilator on here, you're going to pull dilator and wire. Don't forget, this is a wirelessly navigable system. So dilator comes out, wire comes out. This is going to be holding position in the PAs. At this point, the doctor will probably want to advance the cannula up, start the procedure. Either go up with a pigtail or something to take a picture, but once that's done, they want to start the procedure. This funnel just gets introduced in the back of the sheath with a little twist. And just want to remember to remind them to take small bites, about 1 inch in size. It's a small, flexible, easily maneuverable cannula, but it is prone to kinking if it gets pushed too hard. So you can see it's very flexible. One of the drawbacks is it can kink. So just take small bites and take your time getting it up there. One other tip and trick is when you see the funnel going up, the tip of this has radiopaque markers on it, so you'll see it going up on fluoro. Once it gets matched up with the tip of the sheath, and you'll know it's getting close, because on the back end, when you see this silver turn to dark gray, you're about 10 centimeters from the tip of the sheath. So that's the point that we want to hit the pedal and start watching it. Once you get those two ends to match up, and the funnel's coming up, or in the lung, match them up, then you're going to want to pin pull and reveal the funnel by pulling the sheath back, either more proximal in the right PA or all the way back to the main PA. So this is just what's left. And this they can advance, pull back, they can control the curve by how much is coming out of the sheath here. They can use that fin on the handle to twist and steer it. Remember, this is how you steer the device, right here. And this moves independent of the handle. So if you see anyone maneuvering the handle, that's not how you do it. You want to hold the hub of the sheath right here with one hand and twist this with the other, right where you see the little fin. If it clogs, you can pull the whole cannula out of the body. This sheath will still be in the pulmonary arteries holding position. Pull this out and hook up a lower lock syringe to here and just hammer it with saline. That'll get anything that's in here out of it. It's about 25 cc's of dead space. That's useful in taking pictures too. They can take pictures, take pressure monitoring right through here. 25 cc's, so load up whatever contrast you want and chase with 25. If you want to return blood, which a lot of physicians do, most places use this setup with these orange hemodynamics filters. They're kept usually with perfusion or by your AlphaVac devices on in the core. The way these work is you're going to fill this bag as the procedure goes with blood and clot. At some point the bag will fill, or you're just going to want to swap it out, which is why we give you multiple bags. When that happens, lock it, remove it, take a bowl, put a towel over it, unlock it, dump all of this onto that towel. The towel will catch all the clot, the blood will go below into the basin. That's the point that we're going to use this filter. So this orange filter with an 11 French Terumo sheath on the back, an 11 French Pinnacle works perfect. You're going to dip the tip of this into the blood. On the sidearm of that Pinnacle sheath, hook up a lower lock syringe draw back. That's going to pull it through the filter. You can fill up a couple of syringes, however many you can get out of this bag, depending on how full it is. Give it to the physician, and they will then turn and return that blood through your access sheath, through most likely the 24 French gore dry seal you're using. So those are the main tips and tricks. Try to keep it relatively short here, but you guys can always call me or FaceTime me if you have any other questions. Thanks very much.